ko for the remaining 15 minutes sa ato ang psychologist na si Sigmund Freud. Unsang naa ni Sigmund Freud? Contribution niya is revolutionary. Ang tanan ng mga scientist ni tackle og physics, ni tackle og chemistry, usara sa very few during 17th century, 18th century, si Freud nga nag-tackle og mind or what is happening in the subconscious. Atong modern interpretation of subconscious, kung nagkat-on ta og motor, tanan ng mga skill, balancing, coordination, mo descend into the subconscious. Dili naka-conscious nga nagbalance sa motor kung naanad na ka through training. Well, maura na, simplified version sa workings of the subconscious. Pero si Freud, siya'y deeper na theory or deeper explanation sa subconscious. Para niya, it's the repository of a lot of memories. The memories that are being shelved by our mind also because they are painful. They can be harmful. So our pains in the past will descend down to the subconscious because it cannot dwell in the conscious. But this subconscious can make us ill, according to Freud. That is why a lot of people are maladjusted, have something in them, an emotional turmoil. If they come and see Freud, Freud will subject them to what he invented as a therapy. He called it a talking cure. What was in the talking cure? Well, you can talk your way out of your maladjustment or your emotional episode. You will feel better at the end of the talk because the psychologist, the clinical psychologist, will sum up what is wrong with you based on what you've told as a story. What is the role of a psychologist, a clinical psychologist in the talking, or a therapist in a talking cure? Is just going to ask question, elicit more explanation, more story from the patient. If the patient, for example, responded to the question, what were you doing yesterday? Okay. Well, Mr. Therapist, I was cutting roses in my garden. And then the therapist would say, what do you think of roses? And then the story will go, the conversation will go on. That's why it's called talking cure. Well, I think of roses as, it reminded me of my stepmother during the funeral of my father because she placed a very beautiful red rose on top of the coffin of my father. And right then and there, I felt a pang of jealousy. Na jealous siya sa iyahang step-mother. And she's going to continue narrating this jealousy to the therapist. Until what is in the subconscious will surface in the conscious. Okay? It's like uprooting something that created the maladjustment, that created the episode of emotional negativity from the repository or the recesses of your subconscious memory or the id, according to Freud. The id or the unconscious. According to Freud, the Freudian human being is not in total control of his, metaphorically speaking, of his house. His house is a haunted house because what happens to a haunted house at 3 a.m.? It's as if it has a mind of its own. It's squeaking here, piano playing, doors opening without a human turning the knob. Everything is mysterious. According to Freud, that mystery is part of the subconscious. The id is taking over, or is the monster or the ghost that is taking over your consciousness or creating something that will inflict you or that will harm you. The superego will control it, or the superego is your ethical, your your moral, your confidence, okay, making you act in a good manner, making you confident, making you moral, making you ethical. It's the ego, which is part of your personality, that listens to either the superego and the id. Most of the time, if you find yourself emotionally harmed or offended or having a psychological episode, it's the id that surfaces. Suddenly you feel sad, it's the id that surfaces. Slip of the tongue. When you mention Rose, suddenly, instead of rules, okay, that's according to Freud as slip of the tongue. But there is something, this is a weird theory by Sigmund Freud. In fact, psychoanalysis was a weird thing during his time, okay? It's a kind of modern thinking, but people had a difficulty trying to accept the strangeness of the explanation of what talking theory is, of how Freudian human being works, of how the personality of ego, id, and superego would work. So slips of the tongue, you don't intend to say it, but it comes out of your mouth. According to Sigmund Freud, something in your subconscious has slipped into the crack, had suddenly surfaced into the conscious. So that there can have something, an implication to your emotional health in the current phase. So this is how he compartmentalized your persona or your mental construct, that it is composed of the id, the superego, and the ego. The id is the deeper part because you want it to be buried. We buried our pains, okay? We buried also our negative emotions, but they are just buried and stored in your subconscious. Sometimes they slip to the cracks. They surface into the ego so that you have a renewed anger, you have a renewed sadness, because again, from time to time, these things that you shelf into your id will resurface. Also, Freud explained your sexual development. Okay, sexual development. According to him, we go through several stages of sexual development. The infantile or the infantile sexuality, hope you don't mind, according to Freud, we are following the system of libido or libido. So meaning our sexual development is always sexual. Your notion probably of sexual is intercourse, but for Freudian, there are types of sexuality. There's an infantile sexuality which focuses on pleasures of the mouth. That's why there's a lot of sucking of the thumb, sucking of the pacifier, sucking of the toys, because they derive their sexual pleasure or libidal pleasure from mouthing at almost anything or everything they can handle. See? It's kind of weird again for the society to accept that infants are sexually active, but not in terms of intercourse, in terms of submitting themselves to libidal pleasure. And so after that, there was a potty training where parents and guardians are teaching them where to go, where to excrete, urine, feces. That's the stage of sexuality where they experience anal. Sorry for the reference, just discussing anal pleasure, or they derive their libidal pleasure from the anus, from the act of excreting and controlling the excretion. There are kids who love to control their bowel movement and they get a lot of pleasure from it. That's how they, again, let me just spell out the term again, weird theory. But again, the community had embraced it. In fact, Freud was very much the door that opened to open the world into, psychoanalysis. Even literature uses psychoanalysis. So after the potty training, you have the phallic stage where the teenager will masturbate or will derive libidal pleasure from their organ, They start to distinguish male organ from female organ. The latent stage can be very much socially inclined. It's the stage when you are so focused probably in your career that there is a temporary absence of libidinal pleasure, or there's a vacation from libidinal pleasure. It's called latent stage. Little motivation for sexual pleasure, but it returns. It will return after a short course. And you develop genital stage where it's the most mature sexual development. It's the sexual it's the stage wherein you have an intercourse, what you call as proper sexual activity, intercourse leading to children, of course. Sometimes, to explain, last point for psychoanalysis, to explain, very hard personality, you meet people with very, hard to explain personality, hard to get, hard to deal with. They have fixation, for example, OC. You're instructed by this friend to clean up, okay? Because his oral, his phallic stage probably, or sorry, not phallic, anal stage was very rigid. He was really trained to go where the proper place for excretion is when they're about to go. Toilet training was very strict. And so sometimes the child, if he failed to develop into the later stage of sexuality, he's trapped or locked in the anal stage, where OC kayo siya kung rigid din yung training sa iyang papa o mama. Now, kung very lax ang training sa iyang mama o papa, ang isa ka tao is more liberal and more messy. Kung messy ang personality, more liberal ang iyang training, more unrigid yung training. So, fixation to anal, that means to say wala siya ka-reach o mature sexuality. Ang iya is anal sexuality still or she still derive libidinal pleasure from that stage. Sa oral katong smokers, vapors, they don't derive sexual libidinal pleasure from other stages, but more on mouth. Eating, for example, drinking liquor, mauna ang iyahang libidinal pleasure sa mouth gikan. Ang sa anal pod, kani ang iyahang tendency, obsessive, mean, untidy, kung ang iyang training is dili kaya koan, or over conscientious, kung strict ang iyang training, mo na iyang anal fixation. Ang OC na siya anal fixation to cleanliness. Ang messy, naapod siya anal fixation to messiness. Phallic stage, ang maladjustment niya kay vanity, self-obsession, sexual anxiety, inadequacy, inferiority complex, and jealousy or envy. Na siya phallic fixation. Wala siya nakadevelop of mature sexuality, which is the genital sexuality. Hard to explain, but I think you got the point. This is, again, the doctrine of libido. The doctrine of libido, libidinal pleasure, not just sexual intercourse as in the intercourse that you are acquainted with, but according to his explanation, stages of development of libidinal pleasure, and we're fixated sometimes based on environmental pressure or the stress of our environment. Kanang na yung mga fixation ay personality disorder usually, or can lead to personality disorder. Mao na sila ang music og help, emotional help, not necessarily professional help. Dalhunon ng mga attitude, nanay mga fixation. Kamo kung nindot ang inyong development, maka-develop mo until genital stage, which is the normal sex na inyong perception kung unsa man na. Manata sa atong discussion, ang contribution na ragod ni Freud is ang further examination of this ang atong subconscious tungod kay walay X-ray or anything like magnetic resonance, dili ka picture out totally what is happening inside our brain. Sigmund Freud did not have any instrument at all. He was just observing his patient. And according to him, the patient is actually, so to speak, being cured at the end of their sessions. What is the manifestation? Ang iya is very different. He's going to tell the person what is wrong with him, that you have something from the past. It surfaced and then it makes you ill. Okay? And then if the person knows this, he knows his trigger. And if he knows his trigger, he knows how to deal with it. Mauna ang perception ni Sigmund Freud. It's very different from the cognitive psychology, because in cognitive, you identify the psychological problem and you treat it in accordance with deleting or extinguishing that psychological problem, where it's different in Sigmund Freud's psychoanalysis of talking cure, because he's going to use the problem in order to resolve personalities, resolve emotional episodes. He's not going to avoid the problem, but he's going to identify the problem and use it to unearth more knowledge. And in fact, Sigmund Freud used the word excavation. He had more anthropology books than psychology books. Probably that was the reason why he used in his essay the word excavating the subconscious into the conscious and telling the person this is what is wrong with you. Something in your subconscious is inflicting you and causing a lot of pain. Something that you have not resolved in the past. Ang atong grief, usahay ato nang ibutang dayon sa subconscious because we don't want to deal with it. Until such time, mugawas siya sa old age. Okay, we ran out of time. Next meeting Thursday, I'm going to discuss a little bit the environmental crisis, and then I'm going to give you your final requirement